Okay, so you're relaxing at home, right? Maybe watching TV, cat curled up next to you, purring away.
The perfect scene.
Exactly. Then, bam, out of nowhere, a quick nip. Or maybe just a swat. And you're left thinking, what just happened?
Uh-huh. Or that sudden hiss when you just, walk past them.
Yeah, that too. So if you've ever felt that kind of confusion, or maybe a bit of frustration, maybe even a little scared when your cat gets feisty.
Then this deep dive is definitely for you.
Right. We're going past just the playful stuff
You
today.
really are. We're digging into why cats sometimes show genuine aggression towards us humans. Trying to get to the bottom of it, understand the why behind behaviors that honestly leave a lot of owners pretty baffled.
And this isn't just like random opinions. We've looked at expert information here, breaking down the different kinds of feline aggression, what the science actually tells us.
Yeah, the goal today is pretty straightforward.
We want to give you a much clearer picture of why your cat might be acting aggressively. And, crucially, offer some real actionable things you might be able to do about it.
Okay, so let's start right at the beginning. What even is human-directed aggression in cats? What are we actually talking about?
Good question. So, basically, it's any aggressive behavior a cat shows towards a person. But, and this is super important right off the bat,
Context.
context is everything. That little nip during a game, totally different from a hiss when you try to pick them up after, say, they just got spooked by a loud noise.
Absolutely. Understanding the situation is step one, always.
And well, it's more common than people might think, isn't it?
It really is. For veterinary behavior specialists, believe it or not, aggression towards humans is the #2 reason owners seek help.
Wow, second only to.
Litter box issues, inappropriate elimination.
Okay, that really puts it in perspective. It's a significant issue.
Definitely. And it's not like it only affects certain cats.
Right, our sources are clear on that.
Yeah.
Any cat. Doesn't matter the age, gender, neuter status, breed. Any cat can potentially show this.
Though we do see some patterns, right? Like play-motivated stuff often crops up more in younger cats, maybe in homes where they're the only cat.
Yeah, that makes sense. So there isn't just one kind of aggression.
Not at all. Which leads us nicely into breaking down the different types. Let's start with one many people will probably recognize: play-motivated aggression.
Yes, the ankle attack from under the sofa.
Exactly.
So what does that look like? What are the signs we should be looking for?
Okay, so typically you'll see behaviors that look a lot like hunting. The cat might get low, stalk you, maybe do that little butt wiggle.
Yeah, the wiggle?
Right, then maybe a chase. You'll probably see their tail twitching, ears forward, really focused, and usually they're targeting something moving.
Like feet under the duvet or hands moving too quickly.
Precisely. Feet, hands, anything that moves like prey. The key thing to grasp here, though, is it's usually not malicious. It's often just misdirected hunting instinct.
So they need an outlet.
They need a better outlet. Think more interactive toys, wand toys, things they can really chase and kill, and less using your own body parts as chew toys.
Guilty.
Yeah.
I've definitely wiggled my feet under the covers. So why does play turn into, well, aggression?
Often it just boils down to a lack of appropriate ways for them to get that predatory energy out.
So not enough playtime.
Or not the right kind of playtime. If they don't have enough chances to stalk, chase, and pounce on toys, or maybe they don't have another cat to roughhouse with,
Then you become the most interesting prey around.
you got it. And also, this is a big one for owners. If you've used your hands or feet as playthings, especially when they were kittens, or if you encouraged really rough play.
You basically taught them that your limbs are fair game.
Exactly. You've inadvertently reinforced the behavior.
Okay, that makes a lot of sense.
Okay.
So that's play getting a bit out of hand. But what about when it feels different, like driven by fear or maybe pain?
Yeah, that's a whole different ballgame. With fear or pain-related aggression, the body language is usually defensive, not offensive.
How so? What changes?
You'll often see ears flattened right back, body low, tail tucked or low. Their fur might stand on end. That's piloerection.
Goosebumps, basically.
Kinda, yeah. Pupils will likely be huge, dilated. And you'll hear hissing, growling. They'll usually try to avoid, to escape.
So they're signaling back off.
Absolutely. The crucial thing to understand is they feel genuinely threatened, or they're hurting. Your first reaction has to be giving them space, being cautious.
Because if they feel trapped,
If they feel cornered, that fear can absolutely flip into an attack. Self-preservation kicks in.
that sounds intense.
It can be. In really extreme fear, cats might even express their anal glands, urinate, or defecate. And hiding, of course, is super common.
And what causes that level of fear?
Often it traces back to poor socialization when they were young, maybe negative experiences with people in the past. Some cats are just naturally more anxious. And importantly, an underlying medical issue causing pain is a huge trigger.
Ah, so it could be physical.
Definitely. That's why you often see fear aggression flare up at the vet clinic, for instance. The cat associates that place with stress or maybe past discomfort.
That makes total sense. Okay, another type that always seemed a bit weird to me. Redirected aggression. What's going on there?
Redirected aggression is fascinating, and yeah, it can be pretty scary sometimes because it seems to come out of the blue towards you.
But it's not really about you, is it?
Exactly. It happens when a cat gets super aroused or agitated by something. A classic example is seeing another cat outside the window, but they can't get to that thing.
So they're all worked up?
Totally worked up, frustrated, maybe scared or angry, and then you happen to walk by or try to interact with
And
them.
you get the fallout.
You become the target. The intense emotion just gets, well, redirected onto the nearest available subject. The key insight is, it wasn't aimed at you initially. It's displaced. Caution and space are vital.
So if they see the neighbor's cat outside, get all riled up, and I walk past, boom.
That's a textbook scenario, yeah.
Mm.
And because the cat is already at such a high level of arousal, the resulting aggression can be quite severe. Gotta be careful.
Good to know. Okay. Then there's maternal aggression. That one seems fairly self-explanatory. Mom cat protecting kittens.
Pretty much. It's driven by that powerful instinct to protect her young. It's usually quite predictable, directed at anyone approaching the nest site.
And it usually fades, right?
Yeah, it's self-limiting. As the kittens get older and more independent, the queen typically calms down.
Okay. Now the last one listed here, petting intolerance. I think almost every cat owner has experienced this one.
Oh, yeah. The cat's loving the petting, purring, seems happy.
And then suddenly, Chico MP. Or a SWAT. What is that?
It's a bit of a puzzle, honestly. The exact cause isn't fully understood, but what we do know is that cats often give very subtle signals first that they're getting overwhelmed or have had enough.
Like what kind of signals?
Maybe the tail starts twitching or thumping, the skin over their back might ripple or twitch, ears might start to flatten or turn back slightly, pupils might dilate.
So they are telling us, but maybe we miss it.
Often, yes. If those subtle "please stop now" cues are ignored, it can escalate quickly to a hiss, a growl, or that bite or swat. The big takeaway is, even if they like petting, they have a limit. Learn their specific signals and respect them.
So we need to get better at reading cat body language.
Definitely. One theory about why it happens relates to how cats groom each other, mostly head and neck areas. Maybe our full-body petting just becomes too much, overstimulating after a while for some cats.
That's actually really interesting. It feels like all these things, the behavior, the environment, what's going on inside the cat, it's all connected.
Absolutely. Our source mentions how aggression, especially chronic stress from fear or pain, can impact their whole system.
Like how?
Well, stress can affect their digestion, maybe decrease appetite. It can impact their immune system over time. Those dilated pupils we mentioned, that's the autonomic nervous system kicking in.
Right, fight or flight.
Exactly. And some anxious cats might even overgroom as a way to cope, affecting their skin.
Wow, it's a whole cascade. So if you're seeing aggression, it's not just the behavior itself you need to think about. Which brings us to diagnosis. How do vets figure out which type of aggression it is and why it's happening?
It starts with a really, really thorough behavioral history. Super detailed.
What kind of details?
Everything. When does it happen? What exactly does the cat do? Body posture, vocalizations. What happens right before? Right after? Any injuries to people? Are there other cats involved, inside or out? What was the cat's early life like socialization? How are their litter box habits? Eating? Hiding behavior?
It's like you need to be a bit of a detective.
You really do. And then, crucially, you have to rule out medical causes. Could pain be driving this?
So vet checkup is essential.
Absolutely non-negotiable. Blood tests like a CBC, biochemistry panel, urinalysis are standard to check overall health and look for underlying disease.
Especially in older cats.
Yeah, for seniors, a thyroid check is important too. Hyperthyroidism can sometimes cause irritability. And if the cat is also, say, urinating outside the box, the urinalysis is key.
What about things like x-rays?
Yeah, if pain is suspected, maybe arthritis, dental issues, something internal, then imaging like x-rays or even ultrasound might be needed to pinpoint the problem.
Okay, so it's a proper workup, physical and behavioral.
Mhm.
Let's say you've done that. You have a better idea of the type of aggression. What are the treatments? What can people actually do? This is the really practical stuff.
Right. So for play-motivated aggression, the main strategy is more appropriate play. Way more.
Interactive toys.
Yes. Wand toys, laser pointers, used carefully, always end on a physical toy. Puzzle feeders to engage their brain and hunting skills really give them an outlet for that energy.
And maybe another cat, if possible.
If the cat enjoys feline company and it's feasible, yeah, another playful cat can sometimes help redirect that energy. The actionable point is meet that hunting need appropriately.
Got it. More chasing feathers, less chasing ankles. What about redirected aggression? That one seemed tricky since the trigger is external.
It is tricky. Management often involves trying to block the cat's view of the trigger.
So, closing blinds.
Yeah.
Using sticky film on windows.
Exactly. Or maybe using motion-activated sprinklers or other deterrents outside to keep neighborhood cats away from the windows they stare out of. The action here is managing that external thing that sets them off.
If they can't see it, they can't get worked up by it. Makes sense. Now, you mentioned diet earlier. Can food really help?
There are a couple of prescription diets formulated specifically to help with stress and anxiety, things like Hill's CD, urinary stress, or Royal Canin Calm. They have ingredients thought to have a calming effect.
So it's not a magic bullet, but potentially part of the plan.
Exactly. It can be a helpful supportive measure for some cats, definitely something to discuss with your vet. It's another tool in the toolbox.
Okay. And what about just educating owners, helping us understand what's normal and what's not?
That's huge. Client education is critical. For play aggression, it's about understanding normal play, providing outlets, and crucially, stopping the use of hands and feet as toys. Consistency is key.
Right. For fear aggression.
Learning to recognize the triggers and avoid them whenever possible. Pushing a fearful cat just makes it worse. Management and avoidance are often central.
And redirected.
Identifying and managing that primary stimulus, like we just discussed.
Maternal.
Understanding it's normal, temporary, and giving mom space.
And petting intolerance.
Learning your cat's specific, I've had enough signals, and stopping before they feel the need to escalate. Respecting their boundaries. It's really about learning their language.
Okay, becoming a better cat listener. Now, the source also talks about behavior modification techniques, DS&CC, classical conditioning.
Yeah.
Sounds technical.
It sounds more complex than it often is in practice. DS&CC just means desensitization and counter conditioning.
Break that down.
All right. Desensitization is exposing the cat to the thing that scares or bothers them, but at a really low level, like far away or very brief exposure so they won't react badly.
Starting small.
Tiny steps.
Yeah.
And counter conditioning is pairing that scary thing with something absolutely amazing for the cat.
Like tuna.
Like tuna. Or amazing treats, or a favorite game. So the cat starts to associate the previously scary thing with awesome stuff happening. Their emotional reaction changes over time. Scary person equals yummy chicken.
Okay, I get it. Change the association. And classical conditioning.
Similar idea, really. Pavlov's dogs, right? Ring a bell, get food. Eventually, the bell alone makes them drool. You're creating a positive, conditioned emotional response to something they previously disliked or feared. The actionable insight is gradual, positive retraining of their emotional response.
Gotcha. Slowly changing their mind about things. Yeah. Sometimes that's not enough, is it? When do medications come into play?
Meds can be really useful, especially for moderate to severe anxiety or reactivity that's driving the aggression. They can help lower the cat's baseline anxiety level.
Making them less likely to lash out.
And making them more able to learn from the behavior modification techniques we just talked about. If a cat is too terrified, they can't learn effectively.
What kind of medications are used?
There are several classes. Azapirones, like buspirone, are often good for generalized anxiety. SSRIs, selective serotonin reuptake inhibitors like fluoxetine and TCAs, tricyclic antidepressants are also common. These need to be given daily and can take weeks to reach full effect.
So they're not quick fixes.
Definitely not. Benzodiazepines like diazepam or alprazolam work faster but have potential side effects and dependency issues, so they're usually used more short-term, maybe for specific predictable stressful events or during initial DS&CC.
And this absolutely needs a vet, right? You can't just decide to medicate your cat.
Oh, absolutely. Prescription only requires careful veterinary assessment, dosing, and monitoring for side effects. The actionable insight is medication can be a vital tool, but only under professional guidance.
Are there other, maybe non-prescription options?
Yeah, the source mentions things like synthetic pheromones. Feliway is a common brand. Nurtricol is another. They mimic calming cat facial pheromones.
Do they work?
The evidence is a bit mixed, but they can be helpful for some cats, creating a generally calmer environment. There are also supplements like Angstine, L-theanine, or Zilcamine, derived from milk protein, that have calming properties. Again, effectiveness varies. Think of them as supportive.
So, lots of potential tools. It seems like a combination approach is often best.
Very often, yes. Behavior mod, environmental management, maybe meds or supplements tailored to the individual cat and situation.
And once you start a treatment plan,
Oh.
how important is follow-up?
Crucial, especially when you first start or if you're using medication. Regular check-ins with the vet or behaviorist are needed to see how things are going, adjust the plan, monitor for any issues.
Oh, often.
Often more frequent at the beginning, maybe every few weeks, then spacing out as the cat stabilizes. If meds are involved, periodic blood work is usually recommended too, just to keep an eye on things long term. The key is ongoing communication and adjustment.
It really sounds like a process, not a one-and-done solution.
It absolutely is. Patience and consistency are paramount.
Thinking preventatively now. What can people do to try and avoid these issues developing in the first place?
Well, providing lots of appropriate interactive play from day one is huge for preventing play aggression.
Start them off right.
Yeah. And good, positive socialization when they're kittens, exposing them gently to different sights, sounds, people handling that can build confidence and reduce the likelihood of fear-based issues later.
What else?
Addressing any potential pain promptly is critical. Don't let underlying medical issues fester. Managing the environment to reduce exposure to known triggers, like those outdoor cats for redirected aggression. And for petting intolerance, learning those signals early and maybe even doing some gentle DS and CC to increase their tolerance for handling, if needed.
So being proactive about their physical and emotional needs.
That's the core of it, really. Create a safe, stimulating, predictable environment.
Now, there are some important caveats or warnings in our source material, too. The risk of injury.
Yes, that's a serious one. Human injury from cat bites and scratches can be significant, prone to infection. Never underestimate a truly fearful or highly aroused cat, especially if they feel trapped. Prioritize your own safety. Avoid confrontation.
Good advice. And the fact that progress can be slow.
Very important to manage expectations. It often takes time, sometimes months, to see significant changes. Every cat is different. Setbacks can happen.
And if medication is involved, you can't just stop it suddenly.
Absolutely not. Medications, especially the daily ones like SSRIs or TCAs, need to be tapered off very slowly under veterinary direction, usually only after the cat has been stable for quite some time. Stopping abruptly can cause issues.
And even then, can the behavior come back?
Unfortunately, yes. Recurrence is possible, especially if the original triggers reappear or if stressors increase. The good news is, if a previous treatment plan worked, it often works again if needed.
Okay. This has been incredibly insightful. If you had to boil it all down to one key message for people listening, what would it be?
I think the biggest thing is understand the type of aggression first. Stop thinking my cat is bad and start thinking, why is my cat doing this?
Shift from judgment to curiosity.
Exactly. Recognize its communication, however unwelcome. Understand the motivation behind it. Fear, play, frustration, pain. That's the essential first step towards finding a solution.
That's such a powerful reframe. It really empowers us as owners, doesn't it?
Yeah.
Knowing that by observing, by understanding these triggers and signals, we can actually make a real difference. We can help create a more peaceful home.
Absolutely. You can build a better relationship based on that understanding.
So maybe final thought for everyone listening.
Yeah, consider this. How might your own interactions or the environment you provide be unintentionally playing a role in your cat's aggressive moments? Is there one small change you could try, starting today, based on what we've talked about, to better understand and support your cat?
Food for thought. This deep dive is really just scratching the surface, isn't it? But hopefully it's the start of a deeper understanding for everyone.